welcome back to ChroniTalk. I'm your host, Mykayla Lynn, and today I am joined here with Emma Novick. So Emma is a psychotherapist who works with adults managing chronic illnesses, medical trauma, and other major health crisis. So she also has her own lived experience with a condition called hemifacial spasm. So I'm excited to have her here today to talk about what the emotional side of that is, the chronic illness, and as well as the power of self-advocacy and what healing can look like for each individual. So Emma, thank you so much for joining me today. Do you want to just share a bit about your own health journey, how it shaped your work, and how it shaped your life today?
Great. Yeah, well, I'm so excited to be here. Thank you for having me, Mykayla. I guess I wanted to start by explaining what hemifacial spasm is. It's a pretty rare condition, actually. 11 in 100,000 people are diagnosed with this condition worldwide. So it's a neurological condition that causes a involuntary spasm on one side of the face. The spasms are painless, but they can become very intrusive, like in your day-to-day life. They can impact your vision. With some people, it can also impact their hearing as well. But it's typically caused by a compression on your facial nerve, which, like, if we're going to think about this neurologically, that's what's like floating in the back of your skull. It's not actually in your brain. So those nerves are not in your brain. They're kind of floating in the back, connected to your brainstem and your spine as well. So they can be compressed by another artery, like a blood artery, or another nerve, but more rarely a nerve, or actually a brain tumor, a tumor as well, but which is more rare. Hemifacial spasm is also a progressive condition, which means that it worsens over time. I was actually explained when I was getting diagnosed that what causes the progression is the compression is being touched so much that it causes inflammation. And then that's what causes the misfiring for your nerve to move involuntarily. So as you kind of hear my story, throughout this, you'll kind of hear how it progressed into something bigger than it originally was. So I'll get started. Like, this all started in 2017. I felt a very slight flutter in my left eye, my left eyelid specifically. And it wasn't like persistent at the time. It would like come in on and off. It would go away, but it kept kind of coming back every now and then, and it kind of went into the next year. I went for my annual eye exam at the time, and I just mentioned it to the doctor as like, hey, I'm getting this like on and off fluttering, and he just said that it could be due to stress or the amount of caffeine I consume. And I was in school at the time, so I kind of understood what he was saying. I was also working part-time. So I was like, okay, I am under a lot of stress. Maybe this is the reason. But it always like kind of came back every few months on and off. It didn't start to become a persistent like daily problem for me until the end of 2019. So it took almost 2 years for it to become a daily nuisance to me and a daily problem.
To like show itself, right?
Yeah, exactly. Which also is a problem too with going to the doctor for this condition, because it might not spasm while you're in the appointment too. So it started to bother me on a daily basis. I started to do my own research. I'm a person that really likes information and to know what's going on. And I did find the condition called hemifacial spasm.
Okay.
So I found the name of it, and actually my cousin was in optometry school at the time, and she mentioned that it might be something called hemifacial spasm. So I had this idea in my mind that like maybe this is what it is. And because I started to do the research, I knew that there were possible treatments, which the first one is Botox injections into the side of the face that's impacted, and then neurosurgery is also a treatment and a cure as well, but that sounded really scary at the time.
Yeah.
To have to maybe have neurosurgery in the future.
And so did you start with Botox then? You were like, okay, let's give this a go.
Well, I had to go through some hoops because I didn't start to think of it as like a problem to seek medical attention until like early 2020. It started to stretch down my face, so my upper cheek started to become impacted and my lower eye. Pandemic happened, so we were all in a shutdown in New York City. I had originally scheduled an appointment to see my primary care physician to get everything started, but then I had to cancel the appointment because we were shut down. No one was having unnecessary medical appointments at the time.
Yeah.
So it definitely delayed me getting care. I ended up moving back in with my parents at the time, about an hour away from the city. So I like told them about it. My sister, I was living with her at the time, she knew about it, and they started to notice it at times too. It became visible to other people at that time. So in about May of 2020, we got more comfortable with telehealth appointments at that time. So I saw a primary care doctor, and she guessed it might be hemifacial spasm. She wanted me to see a neurologist and to be assessed by more of a specialist at the time. So
Right.
I made another telehealth appointment to see a neurologist. Again, she was pretty sure it was hemifacial spasm, but you need a MRI to confirm the diagnosis. So I went for the MRI. It came back with nothing, like everything was normal in the MRI. So I was then referred to a neurologist back in New York City to start Botox treatments. So I had my first round of Botox and wasn't like prepared for what it would feel like to have needles not only like put in my face, which is how people normally get Botox for aesthetic reasons, but they actually inject into your eyelid to prevent it from spasming. The Botox is just a Band-Aid though, because
Yeah.
what it does is it freezes your face, right? That's why people get it for aesthetic reasons. But then I could feel the spasm still. So it was very disorienting when my face would be
So-
frozen.
Was it like a larger dose? Like I have chronic migraines and I got Botox for the migraines and they did it, on my whole face, my neck, the back of my head and all, but it was like micro dosing. So did they do like a bigger dose but just in the eyelid?
No, it was basically all over the left side of my face because
Okay.
at that time the spasm had stretched all the way down my face. Like my side of my mouth was also impacted now, and it also starts to go into your neck. So you can feel the spasming stretching down that far. So the Botox, they would at that time when I first started the Botox injections, I wasn't seeing a doctor that specifically specialized in hemifacial spasm. He actually did Botox specifically for migraines, actually.
Okay.
So he started doing the treatments and I wasn't really liking the results.
Yeah.
So I asked him about like possible medications because I had done research. I also found a Facebook support group, which I can also talk about as a resource at the end,
Yeah.
to get more information about like how to manage this condition.
Right.
So people had like taken medications and six medications in that Facebook group. So I had asked him about it and he said, at this time I actually don't feel like I am the doctor to be treating you. Like I don't feel specialized enough. I think you should find another doctor, which was like a little disheartening because why did he
course.
take me on in the first
Yeah.
place, right?
You kind of feel like I'm left here. Okay.
Yeah, and with no referrals. So I had to go and find someone myself after that. Luckily, living in New York City, we have a lot of doctors. There's a lot of doctors who specialize in rare conditions. So I was able to find a doctor who specifically specialized in movement disorders, which is kind of where hemifacial spasm is categorized under, and she was very familiar with it. So I met with her and she said to me, like, give me a year, let's do the Botox treatments every 3 months and tailor them to your needs and let's see where we are. So we went through, every 3 months I would come in, I would show her like videos and pictures that I would take throughout the 3 months to show her how the Botox was reacting. Botox takes about 2 weeks to implement and work in your face, and then it starts to slowly dissipate right naturally out of your face. So you have to get it done every 3 months. So I would say about, our second or third trial, I experienced something called ptosis, which because she was injecting into my eyelid drooped and I didn't have control over my eyelid anymore.
That's very difficult.
Yeah, and I had my cousin's wedding like a couple weeks later. So,
Girl.
the anxiety about being in pictures and, having to be around people that didn't know that I had this condition was very upsetting to have to go through that. So after that, the doctor decided that we're not going to inject in the eyelid anymore because it wasn't working well for me and she didn't want me to experience the ptosis anymore. Luckily, because Botox dissipates, right? Like I got full control back over my eyelid once it started to get out of my body at that time.
Thank goodness.
Right, yeah, it wasn't a permanent thing. So yeah, we got to that 1 year mark and I was kind of hitting a breaking point because I knew that Botox wasn't a cure for this condition. I said to my doctor at the time, like, I'm 28. I have a lot of life to live, and this is a progressive condition. You know, what's the prognosis? Like, what's the plan of how am I going to live with this for the rest of my life? So she started suggesting, like, oh, we could do nerve testing, we could explore other options, medication. And I said, what about seeing a neurosurgeon? And she discouraged it at first. She said that, you know, the surgery doesn't always have success rates. Like, you still might even need Botox after getting surgery. And then ultimately, she said your MRI didn't have any physical evidence that you have the compression going on. So I can't send you to a neurosurgeon if you don't have any physical evidence on your MRI. There's no physical cause for your condition. So I said, like, I want another MRI. It had been 2 years. I was like, my insurance will cover this. I can have another MRI.
Right.
So,
and it's progressive.
Right. So maybe it got worse since 2020, which it had. Like, it had progressed further down my face since the original MRI, and it was more persistent. It was happening all day, every day by that moment. So I went from the updated MRI, and a couple days later, I got my results, and it came back with a compression on my facial nerve 7. So I spoke with my neurologist on the phone, and again, she tried to discourage surgery. But at that point, I was just ready to take that step. She referred me to a neurosurgeon within the same, like, medical conglomerate that my doctor was at. And I specifically wanted to go to this medical conglomerate because they specialized in this, and they had a neurosurgery department that did this procedure that I would maybe need to have eventually.
Right.
So
it makes you a little bit more comfortable, at least.
Knowing that they knew this condition, I mean, I didn't realize how rare it was.
Yeah.
Until talking with other people, seeing neurologists that didn't even know how to treat this condition properly. So I didn't understand actually how rare it was until later on in this journey of figuring things out.
I didn't waited, so I'll be honest with the viewers here. I was like, how do you say it? I didn't look it up. I was waiting. I wanted to know your story. I wanted it to feel natural, and I want to be educated properly from somebody who has experienced something firsthand. And I think that that's one of the most important ways to advocate, is to tell other people, this is what I'm experiencing, this is what I'm going through, because not every story looks the same, and not every first MRI is going to show something. But just a moment for, like, your incredible self-advocacy, because, like, you continue to push to say what you wanted, you documented things, like, just your process was very good.
Thank you. I really appreciate that, and I appreciate the, you know, learning and understanding that we don't know everything, right? And that we can't assume to know everything, and it's important to always have that place of acceptance that we need to learn and and listen to people, right? So that we keep learning things that are not, you know, quote unquote normal, or that, you know, things are going to change or be different for people and have different experiences. Even if you have the same diagnosis, your experience could be totally different. Yeah.
Yeah. Totally. So this was your turning point. This was when you were like, I am convinced this is how I want to handle this. I would like to look into the surgery option, which did make you nervous, but you were ready to explore that option.
Yeah, I think it was my mental health really started to get impacted by this condition. My self-confidence got severely impacted because I was so just aware that people might notice it, or people might wonder, like, what's wrong with her face. It's your face. It's like something that's so important to your identity and how you appear into the world. It's the first thing people look at when they're talking to you.
Right.
And at that time, right, this was all during, like, pandemic, COVID times. I was on video calls all the time. So I became aware, like, what my face looked like on video calls. So all day I would be spending so much energy on controlling my spasm. So at the end of the day, I'd be so exhausted, and just, like, my whole face would hurt because I'd be trying to constrict it so that it wasn't visible. So I was just so ready to figure out, like, how can we solve this problem at the moment.
Definitely.
Yeah, and I met with the neurosurgeon. We had a consultation. My parents ended up joining me, which was really helpful. I think that was my first health experience, going through this mostly alone. Like, I could call my parents. I had my friends to lean on and my family, but I was not living with family. I was living with a close friend at the time who was helpful, but I was really going through the motions of the Botox treatments and all these appointments on my own up until we got to the point of going for the consultation with the neurosurgeon. So it was really nice to have other people a part of that appointment, right? When you go for these types of consultations, like a surgery and specifically a neurosurgery, right? You want other people there to like ask questions that maybe you're not thinking of. And just to also get an assessment on trusting this surgeon to perform a pretty invasive surgery.
Definitely.
Yeah, it was very nice to be able to have my parents there with me. And we met with the surgeon, and it was a really validating experience. He showed us my MRI and like showed us where the compression was and how much inflammation there was, and that's why there was so much misfiring happening, and that's why the spasms were so severe or getting to the point of pretty severe. And he actually said that this was his favorite procedure to perform. Surgeons, you know, they have their ways of describing things, right? But he said that it's such a rewarding surgery because, you know, if you wake up without this spasm anymore, it's like people get their lives back. So
Yeah.
he got to see those transformations, and it was meaningful to him to be able to give that to people.
Yeah, there's very few surgeries out there that like often quote unquote will cure something. So I do imagine that would be pretty satisfactory for the surgeon themselves.
Yeah, definitely. He was really validating too about the psychological impacts of this condition. He was really aware of how it can really impact your confidence, how it can make you want to isolate yourself, not be a social person anymore, which was the first doctor really to validate that for me, the mental and emotional component of having this condition. So I kind of, you know, after reviewing a bunch of other questions, my parents and I really felt confident that this was the right thing to do. I was, you know, still young, healthy. He said that it's better to do this procedure the sooner the better because of how progressive this condition could be. It can weaken the facial nerve from how much friction is being caused by the compression. So he was saying the earlier you do it, the less chance of nerve damage, actually.
Oh, that's really good that you were able to advocate to the point you caught it that early. Because really, if you didn't, would you have caught it as early when everyone was kind of pushing you to the side a little bit?
Yeah, who knows, right? Like if I didn't advocate for that second MRI, I don't know where I would be right now.
Yeah, 100%. And so as someone who works with people who have emotional and psychological effects from chronic illnesses, disabilities, mental health struggles, what is like some of the biggest struggles that you see and how you would often navigate those people in their coping mechanisms or anything that could kind of help guide them?
Yeah, I mean, I think, you know, if we're going to talk about mental health symptoms to begin with, I think depression and anxiety are really common. I think in my experience, I really felt those depressive symptoms coming in of kind of feeling that helplessness, feeling like persistent sadness every day about having this condition. And then I think once I had agreed and, you know, elected the fact that I was going to have surgery, that anxiety really kicked in of it being scary to have something like a neurosurgery at that time. I think other things that I see, this wasn't really relevant to my story, but working with clients who are managing chronic illness is a lot of medical trauma. And medical trauma is really those interactions with the healthcare system, with doctors, with getting a diagnosis, where we're experiencing emotional and psychological distress based on those experiences. So it's beyond really the physical component of managing a chronic illness, but it's also those distressing emotions and experiences that we might have based on the memories of what we had to endure going through these, you know, appointments or surgeries or something like that, where it felt like we weren't being heard or someone wasn't listening to us in those moments. I think, you know, a big part too is just that isolation, not feeling like people can relate to you. I think, you know, people have great intention of saying like everything's going to be okay, you know, oh, it's not that bad. Like I think people really mean well when they say things like that, but it's very minimizing to the person who's experiencing these illnesses.
Totally.
So I think that you tend to not want to socially engage. Like you tend to want to isolate and be alone, because if someone can't relate to you or someone's going to keep saying these comments to you, it's just not enjoyable anymore to hang out with people or be social.
Yeah. And I think that happens in the medical setting a bit too. Like myself, as I've like kind of grown up, I'm like, oh, like I'm trying to understand from their perspective that when they say something to me that I'm like taking that's like hurting my feelings, I'm like, you don't get it, you don't understand. Now I'm like taking a step back and I'm like, why don't they understand? Is this because you're not a specialty doctor? Like I try to go more through the steps, because often people do have a good intent behind their comments, and sometimes they do not, and sometimes they're just purely not educated, and that can happen. But most times they think that they're helping, or they think that they're trying to, I don't know, support you, and really they're not. And it happens in the doctor setting too. But when you can sit there and acknowledge what's happening and be more like, you are trying to help me, but can I rephrase this, and can you try to help me in this way? More an external factor, not so in it, not so emotional. I think that stuff kind of really helps.
Yeah, but that takes so much effort, being able to zoom out, right? And not feel emotionally impacted by, needing help or asking for help or setting boundaries, setting expectations, because it feels so emotional, right? Because you're living with this on a daily basis. This is impacting your daily functioning. And then I think what a lot of people forget, including medical professionals, is your quality of life changes.
I mean, I go there and I like cry about my quality of life like every time I'm there, and I get emotional even when I try to take a step back. But like I try to do my best to collect myself and say like, hey, I understand what you're saying, where you're coming from, but could we explain it like this, or could we go about it like this? But I think that sometimes you're just so in it. Like for years, I wasn't able to even comprehend understanding the doctor's side, because I was so depressed. I had so much medical anxiety, so much medical trauma, and not that I don't anymore. It's definitely not it. I'm just trying to like learn different ways to navigate and cope. And I think like that's also a part of this community and base too, is allowing people different resources and ways that they could cope, or reach out to other people, or find a community to connect with, or find a therapist to connect with, like someone, some key to some little answer of I feel heard.
Definitely. I mean, I think if, a therapist is that person for you, it's so helpful to have them as a part of your care team. It's also helpful, too, to find at least one person in your daily life that gets it and that listens to you and that is really there for you and shows up for you. And that could really be anybody, right? A family member, a partner, a friend, a neighbor. It could be really anybody that sees you and gets it, right? And that's such a helpful tool to have. That I think that would be one of my biggest like coping skill recommendations, is to have that support system, to have people who do get it. And maybe there's not someone who can like really understand and relate to you because they're not experiencing what you're experiencing, but maybe they can have the sympathy that this is what your life looks like, this is what you need to change in your life to live in a different way.
And even help show up for you. I mean, like you brought your family, like you said, to just help listen to the conversation, help ask questions. I did the same thing. Like we had to have this little boardroom meeting, and I brought my mom and my boyfriend, and was like, sometimes my ears almost turn off in moments too. I'm just like kind of checked out, not really listening to what's happening. Or maybe I can't form the questions because I feel so under pressure.
Right, which can be sometimes a symptom of medical trauma, right? We can shut down, we can feel overwhelmed, we can start to feel emotionally numb in these moments because it's very overwhelming. I think we forget that it's like we're talking about our body and our person, because when medical doctors start looking at you, they start looking at you like a medical case, right? Which is true. Like that's what they're doing, that's their job, but they forget about the humanization of this.
Right. Sorry, I get so thirsty. Okay, so let's bring it just a little bit back to loop it to your story. So you got the surgery, and then what? Did you feel immediately better? What was recovery like? Have you had any sort of hemifacial spasm since, like anything of the sort?
Yeah, great questions. So I had to schedule my surgery in a kind of tight way. I was like moving apartments. My brother was getting married out in Arizona in November, and then my sister was getting married in January in South Carolina. And I just like felt like I needed to get this done, and my parents were really supportive, like get this done when you can. So I scheduled it in the middle of my siblings' weddings. So like 10 days later, after my brother's wedding, I went and got the surgery. I woke up spasm-free and have been ever since. So I have not had any type of residual effects of having this condition, which is a really amazing feeling. Waking up from surgery, like you didn't, I mean, you're so disoriented waking up from anesthesia, but it didn't really set in until like after the fact. I was like discharged from the hospital and feeling this like really big sense of hope and like feeling inspired that like I have my whole life back. Like I'm not afraid to be on a video call anymore. I'm not afraid to meet new people. I can have my photo taken and not be self-conscious anymore. It doesn't impact my daily life like it did. Everything triggered it, like eating triggered it, laughing did, like the things that you enjoy doing every day would trigger the spasm to happen. The recovery wasn't like, this was my experience. I just want to emphasize that it wasn't too bad. When you hear you're going to get neurosurgery, you're going to have a craniotomy performed on your skull, you think like this is going to be super intense. And, you know, it is intense. It was an intense procedure. It was 4 hours long. Recovery was mostly just like taking it easy. I would get pretty bad headaches and some pretty bad like muscle neck pain into my shoulder. But I had to call like a follow-up call to ask like, why am I in so much pain? Like my neck was hurting a lot, and they had to remind me like they had to cut through muscle to like open me up, right? So everything was reconnecting and healing again.
Yeah.
So that's why I was in a lot of pain. But overall, it was really managed with like, you know, pain medication and just resting. I was on like 3 months. I couldn't bend. I couldn't lift more than 10 pounds. I couldn't like go swimming or anything, but it was the winter here, so it didn't really matter. But yeah, like overall, to get my life back and to never have this condition again, it was, I would not regret that decision one bit to have that surgery.
That's life-changing. Amazing. Yeah, and that you're on the other side with no residual effects. Amazing.
Yeah, definitely. I mean, I know from other people's experiences who have this condition, not everybody wakes up spasm-free. So I do feel really fortunate and, you know, the privilege of being able to wake up and, you know, have no spasms and still not having spasms over, you know, 2.5 years post-surgery. So, you know, I do want to acknowledge that this doesn't turn out this way for everybody. Some people do have to go back in and have another surgery to try to decrease the compression. So, you know, just want to acknowledge that it doesn't turn out the same way for everybody, which
100%.
is so, you know, it's important to acknowledge that.
I definitely try to acknowledge, like, you know, every episode or every other episode so far that, like, none of our stories are ever going to be the exact same, but also that, like, we can be a little rare piece of a rare piece, right? So sometimes you won't match the statistics of even the rare people. So I think it's just very important to advocate for yourself, like listen to your gut, listen to your body, and just try to share your story with other people so that it can help educate them. I am no way any sort of like medical advice or anything. Like, this is all just perspectives and stories to try to help each other. I think that it's really amazing that as a therapist that helping people with chronic illnesses and disabilities and mental illnesses, even that you have like experienced that firsthand. So if someone is looking for that extra layer of comfort where they're like, you know, I'm kind of looking for someone who gets it, you do have that element of getting it a little bit more, and I think that that's very beneficial.
Definitely. Yeah, having some insight what it's like to be a patient and have to advocate, and that burden, you know, unfortunately, at least in the United States healthcare system, that burden is really put on the patient to advocate. And also coordination of care is really put on the patient. Like, you might have multiple providers as a part of your care team based on your diagnosis, and you even need to make sure that they can communicate, right? Like, they're not going to do that for you, which, you know, is a full-time job sometimes, being able to do that.
Yeah. I find gaps even in Canada here, like certain things aren't uploaded to like a Netcare is what we use here, and so they're like, oh, that's not on Netcare, and I'm like, yeah, but I did it, and there's a lot of gaps still. So I think no system is perfect, but navigating your way through it the best that you can. Mm-hmm. I'm just gonna take a moment to just make sure like we're good. I don't know where we are.
It's okay.
It doesn't matter. This is what happens.
No, there's a nice flow so far. I feel like one thing I want to add about kind of the ending of my story was really So on my 1 year anniversary of having the surgery, I followed up with my surgeon to just like let him know how much he changed my life. And I think doctors, neurologists, and neurosurgeons get this reputation that they don't care necessarily about their patients, right? Like they do the surgery and they leave, and you might never see your surgeon again, like after they come in on check on you after your first initial checkup after the surgery. He responded to me and was just so grateful to hear that things were so successful for me.
That's so nice of you, because like I'm an empath to the bone, and like if I was a surgeon, I would think about people, and especially like a case like that where he knows it can change your life. So to hear from you, like that's so nice of you to do.
Yeah, it was an emotional day, that 1 year anniversary of being able to reflect that it was behind me. I think it took me a little while to process, after getting through the whole thing of, the first symptom to the Botox treatments and then to having the surgery. It took me that full year to really process everything that had happened.
Yeah, that's definitely a lot to experience also in a short period of time, from feeling it to diagnosis to surgery to not having it anymore. That's a lot of emotion to experience really fast, and then just be like, oh, I'm on the other side now. So wow, congratulations for getting to your 1 year.
Thank you.
That was amazing. Yeah. How long are you now? When was that?
I am a little over 2.5 years now.
Amazing.
Yeah. So
your focus has shifted straight to work, helping other people. What are you doing now? What do you love to do?
I think I got my interest back in weightlifting, being able to exercise. I didn't prioritize that when I was having the condition, because I didn't, as part of my like kind of depressive symptoms, I started to not really care about my appearance. I didn't really care to make myself look a certain way, because I almost kind of wanted to camouflage myself because of the spasm. So I've gotten way back more into prioritizing myself in that way, like, exercising, having my hair done, putting on makeup, feeling confident in myself, which is, important, right? Like
so important.
This is
and
us.
You look amazing.
Thank you.
So it's all worth it, because you're like, yes, I look good, and you do look good.
Thank you.
You're welcome. Is there anything else that you want to kind of add, or about your story, or about anything else that we talked about?
I think, to connect it back to the mental health component is really to like tap into that. I think with chronic illness, with illness in general, one of the reasons why I kind of became interested in working with people managing chronic illness is that it's not a thought about thing at the beginning of when people are getting treatment plans. I always found it really interesting with like family members that I have and people in my life who were diagnosed with autoimmune diseases or rare conditions, that getting therapy or having a mental health help wasn't suggested in the first place.
That's not good.
Yeah.
That should be like the number one step.
Yeah, it's just not thought about maybe. I think doctors do, like a depression scale sometimes to see how you're doing mentally. But even at that initial appointment or that initial diagnosis, your mental health can change throughout that time.
Yeah, and like you could also be like completely collected and feel like you're not struggling, but still just need help like navigating and coping. Like you don't necessarily, have to be some textbook to get help. Like I think it's good to have any sort of like extra support for your mental health when you're experiencing any sort of illness, honestly.
Right, and I think a lot of people think they need to come to therapy when they're in a crisis or they like quote unquote like hit rock bottom, right?
Right.
But therapy is also like a maintenance thing, right? It's you can come and just say like, I just got diagnosed with this condition and I don't know how it's going to change my life. That's a huge topic to discuss in therapy to begin with.
Definitely. Yeah, sometimes I go and I just like dump for like half an hour. This is what happened since the last time I've seen you. And then I'm like, okay, let's go now.
And we're here with you for that ride too, right? Like I think it's so important to have that therapist, that neutral person, that non-judgmental person in your life, because like we're with you for the ride. we're waiting to hear the updates too on how your doctor's appointment went.
Right? Yeah. And I can genuinely like see that there's like care, you know, like when I go in, like there's a genuine care of like, how's your health doing? How's your mental health doing? How's your relationship doing? It feels like there's not any sort of aspect that's forgotten. And I think that's the part that like helped me so much to get to where I am, is like that portion of being validated, being seen, even just by one person, like you said, is so important. Like one person can help you through the whole ride sometimes.
Yes. And remind you, right, of advocacy. Like I think that's comes up in my sessions a lot with clients, to remind them, like, have we asked the doctor this question? Like, have you asked someone in your support system or someone you live with to help you do the thing that's hard for you to do right now, right? It's someone else to have this kind of outside perspective to give you, right, those suggestions of like, we can maybe create a solution for the problem that you're having.
Yeah, I love that perspective, because sometimes we forget to ask when we feel like really alone. We just feel like a burden to other people. So that's amazing to be able to let them know, like, sometimes you can just ask for help and there's all these people just waiting to help you.
Definitely. And I think that's such a great place to start with advocacy, is to just like name your diagnosis or name your symptoms, make a list of the things that you might need help with, and then make a list of the people you have in your life and pick one to talk to. Just start there.
Yeah. Yeah. Thank you for that. I appreciate that. Anything else that you'd like to add in?
I think the biggest thing is to just know that you're the expert of your body. I think to always return to that. You know when something is different. You've lived in your body forever long, however many years you are, right? And you know when something feels different or feels off, and to keep talking about it, to keep asking questions, to keep telling the doctor, whoever you need to, like, something still doesn't feel right.
100%. That's why I keep saying keep the conversation going. Always, every space, keep the conversation going. Thank you so much, Emma, for everything. I appreciate you coming on today and not only sharing your story, but as well as sharing the work that you do and how that work can really benefit other people. So I'm going to give you a moment to just share your socials, how people can find you, and what resources they could get from you.
Yeah, of course. So if you are a New York State resident, I do work with adults who reside in New York State. You can follow me on my Instagram, which is at Emma Novick _LMSW. You can also reach out to me via email if you'd like to connect there, which is emmanovichtherapy@gmail.com. And, you know, feel free to reach out, shoot me a message, and I'm always open to discussion. Even if you're not a New York State resident, I can't treat you as a patient, but we can always, you know, talk over the internet. If you have any type of symptoms related to hemifacial spasm, I'm always here to talk about that.
Amazing. Thank you so much. I will also post Emma's socials in the show notes. So if you need a little reminder, they'll be below. And remember to keep the conversation going, because that was the key point here. But that you're believed and that you are seen, you are heard. There are people waiting to talk to you or be a support for you. Emma, myself, my inbox is always open. You all know that. So give yourself grace, keep the conversation going, and until next time, guys. See you later.
Thank you.